Hi, this is Dr. Balanoff, and I thought we would spend a little bit of time chatting doctor to doctor or doctor to dental hygienist. We have patients, and they're very concerned about their well-being, and they want to have access to us. What patients don't want is to try and call us, and then it gets to a telephone tree where you've got to press 1 or 2 or 3, and sometimes they get to an answering machine or they get to an answering service. Patients really just don't like that. If you truly want patients to know that you care about their well-being and you want to make sure that they truly understand that you're there for them, there's a real simple technique to do that, which is to give out your phone number, your personal cell number. And a lot of times hygienists and dentists will say, well, I'm never going to do that. But what you're going to find out is when you do that, very rarely does a patient ever call. And in the 35 years that I practiced dentistry, I probably had, in all of those years, 35 years, I probably had 10 patients call me on my cell phone. And the 10 patients that did call me, they truly needed to talk to me because they were in pain or they were having some post-operative complications from the implant surgery that I'd done for them. And those are the patients that I want to talk to, and I want to help them. So what's the best technique for that? Do you have cards printed out ahead of time with your name and phone number on that? You can, but it's very impersonal. The best thing for you to do is sit down in the dental chair, in your operatory chair, and you're sitting with the patient right there after a procedure. And you want to be able to look in the patient in the eye. So you're not standing above them and looking down, because that's a very intimidating thing. You want to be able to go eyeball to eyeball with them. You want to be able to tell Mrs. Baker or your patient John or your patient Bethany that you've just done a very complicated dental procedure on them. And if they have any complications or any questions at all, you want them to know that they can call you, they can reach out to you. And here's the way you're going to do it. You're going to say, Bethany, we've just done this really complicated implant surgery on you. I really don't expect any difficulty with this at all. And in fact, we've done this so many times that for the most part, they're pain-free. Every once in a while, a patient's got a concern. Maybe they're concerned about bleeding or swelling or a little bit of pain. And if that's the case for you, I want you to know that you can reach out to me personally and directly. So what I'm going to do for you is I'm going to go ahead and I'm going to write down my name, which I know you know because you're my patient, but I'm also going to write down my personal cell phone number. And this way, if anything happens, you're going to have this. And I want to give this to you, and I want you to put this in your purse, or if it's a man, I want you to put it in your pocket or your wallet. And I want you to know that if you have any problems, that you can call me. And it's actually the same thing that I do with all the dentists that subscribe to our YouTube channel. And if you haven't subscribed, please subscribe because we've got so many fun things going. Any dentist that ever wants to talk about dentistry or some of the angst or some of the challenges that we have, I am always available. And I talk to dentists literally all over the country. And when the dentists do call me, they truly do have a problem or they're perplexed about what to do next. So my personal cell number is 954-683-2693 because I want you, the hygienists and the dental assistants, the dentists that subscribe to this YouTube channel and watch the YouTube channel, the YouTube videos that we produce for your dental practice. I want you guys to know that I care passionately about your success. And I want you to have my personal cell number to call me, 954-683-2693. That's what Dr. Balanoff does. That's what Smile Perfected does. We want to make sure that we help you, and we want your patients to feel that same love. So give out your phone number, give out your name. Believe it or not, very few patients are going to truly call you, but when they do call you, they really need to call you. Thanks a lot.